We are the nurses with People Care Health Services. I am Christy Post, the lead RN, and work out of the West office.
I'm Jen. I work out of the North and the East offices as well as the West.
And I'm Sherry. I work out of the South office. And we're here today to talk about bedbound care. We're going to show our caregivers and clients how to do a bed bath and all the various things that go along with that. And Christy here is going to be our client in the bed, and Jen and I are going to be the caregivers. So the first thing we're going to do as caregivers is we're going to gather supplies. And you can see I have things laid out here. I don't know if we can see that. You're going to gather, if you've got a basin like this, if you don't, you can use a clean bucket, you can use a dishpan, kind of whatever works to bring some water, because you're going to need to have clean water for rinsing and when you're soaping up the client. And then we have plenty of towels, we have an extra blanket as to use kind of a privacy blanket, washcloths, gloves, the soaps, lotions, anything else we might need, if we need a Depend, and these other supplies that we need. And you can see here we have some some steps that we're going to be going over piece by piece, and we will show you that again later. All right, so the first thing we're going to do is Jen and I are going to put gloves on.
And we've already washed our hands.
And then we're going to move things closer. So you're going to have everything close to your client as you're getting ready to do that. And then we will reposition our client in the bed so that we have the best access. I'm also going to bring a Chucks over. It's a good idea to put a Chucks underneath or extra towels if you don't have one, to keep the bedding dry unless you're getting ready to change it, but you don't want to soak things into the mattress pad. Okay, so we're going to tell our client what we're doing. First thing we're going to do is, Christy, we're going to take the sheet off and put a blanket on, and we're going to pretend that we're undressing her and we're moving her over, not necessarily in that order. So.
Very good. Okay, Christy, we're going to have you scooch a little bit towards me.
My left side is kind of weak, so
Left
someone
side,
has
okay.
to help.
Yep, we'll help her move over.
Very good. Bring up your pillow here. We want to make sure the client's comfortable, but that also we have the best access. So, Christy, I'm going to have you roll this way.
Now we're going to put the Chucks underneath because we can have this rolled. There we go. And then come back this way. And then you pull the rest of it through. And then you have a nice Chucks under that area. There we go. Are you comfortable?
Yes.
Okay. So our next step, we have our client moved over. We have a Chucks under as we moved her. And now she has no clothes on, so we're going to be very careful of her modesty and privacy, as well as keeping her warm. So this is the time where we make sure that our door is closed, our blinds are closed, curtains if you have them, if you have a ceiling fan, you have it turned off, anything like that. So before we take the sheet off and put the bath privacy blanket on, we're going to put this underneath, so when we take the sheet off, she'll actually be covered. And then we're going to help her bathe one section at a time, keeping only one part open so that she doesn't get cold and she has that modesty and privacy. Okay? So the way you can do this is you put the blanket underneath the sheet and have it covering her.
Okay. And then just bring down the sheet a little bit. There we go. We want to encourage independence as much as possible, so we're going to have Christy do what she can. Christy, can you wash your face? Would you like to wash your face?
My left side is weak, so I can do some things with my right hand, but not always the other side.
So we have soap on this washcloth, so she's washing with the soap, and then when she's finished with that, we will put that washcloth aside and bring a fresh washcloth that has just water for the rinsing part.
Good. Set the dirty washcloths off to the side that are used. Very good.
And then we will help her with the areas she can't reach when she's completed what she can do. All three steps, the soaping, the rinsing, and the drying. If you have a drying towel, we could have Christy kind of dry that side, and then we'll do the part she can't reach.
Good.
Wonderful. Wonderful. Thank you for helping,
It
Christy.
feels so good.
Okay, so now we're going to do under her. She said her left side is weak, so we're going to help her underneath that arm and underneath the other arm, and to do the right side.
So soapy washcloth first. I'm going to clean under the arms, down, under the breasts, across the chest, and then on this side as well. Up and down, across, under the arms, under the breast, chest, good. You want to expose only the area that you're cleaning. So I'm going to get a clean washcloth.
To rinse, we'll
To
rinse all the
rinse.
soap off
And
now.
rinse off all the soap. Up and down, around, under. Up, down, in.
Making
around,
sure that
under.
you get all the soap up. And sometimes you
Yeah.
might have to use 2 washcloths to rinse the soap. It's very important we don't leave that soap on.
And then you want to make sure to dry really well, especially under the skin folds, under the arms. Reduce the moisture that way. And then we're going to dry. Dry. Good.
And since Christy's left side is weak, we also want to make sure that we're getting in between the fingers. She probably has a hard time washing her hands, so we want to make sure to get in between all the joints too, and make sure they're clean and dry.
Very good.
Okay, so now we'll cover that up, and now we're going to do the main part of your body. So we'll keep her legs covered with the sheet, and we'll bring up the bath blanket too, so we can reach her trunk.
Alright. Very good. Same thing. Use a soapy washcloth first. Clean up and down around the trunk areas, into the folds.
This might be a
Using
good
clean
time.
rag.
This might be a good time too, after we do the front part, is to have her roll on her side and do all of her back.
Do her back, yeah.
And then we're going to come back and do the perineal care, and this Christy happens to have a catheter as the very last step.
Okay.
So Christy, we're going to have you, can you help us roll to the side a little bit, and we're going to bathe your back.
Very good.
And sometimes it
Turn
helps
that
to bring up this knee a little bit. Ready? 1, 2, 3, here we go.
Very good. Good. Now we're going to get her backside. Clean, fresh washcloth. Start from the top, move to the bottom. Cleaning with soapy rag first. In between the crack, get a clean rinse washcloth. Again, go in the same order and direction in between the folds and down. And then we're going to dry.
Dry thoroughly.
Dry the skin very well. And then, do you want to
Yes.
look at areas that might have pressure? When we're doing our bed bath, we also want to make sure we're doing a really good skin assessment. When you're looking at their backside especially, because those are areas that are really prone to pressure and therefore prone to wounds. So we're looking at the shoulder blades, the mid-back, even the back of the head, down the spine, and then the hips, buttocks. We will also, when we get to the legs, be looking for those same things on the knees, heels, and ankles, in between the knees, on the ankles, and then the heels are prone as well. So as you dry, you cover, and then have, okay, Christy, you can come on back.
We'll help her a little bit because she has that left-sided weakness.
Very good. You want to make sure you're also asking if they're comfortable throughout the process. Is the temperature good? Are you comfortable?
As long as I stay covered.
Very good.
Okay, we're going to uncover this leg. We're going to do one leg at a time. We're going to start at the top and go down, and then we'll finish with between each of the toes with soap, rinsing, and drying.
Good soap. Rinse. All the way down the toes, in between, back, behind. We're going to look and inspect the heels.
Can I lift your leg up and look?
Very good. We're going to get a rinse cloth then. Rinse same direction. So then we'll dry, and we're going to do the same on the other side. Very good.
All right.
Okay.
Okay, so the last thing we have to do is the perineal and catheter care. So it's very important with this area. If a client can participate, you can have them. They can help soap up their privates, and you can help rinse the private area. So for a female or a male, you want to make sure to get on all those folds and get it nice and clean and get it dry. So we're going to actually show you a couple of things. So Christy, I'm going to undo both of your legs, okay? So that we can actually, for a woman, you want to be able to spread their legs so that you can get into the perineal area appropriately. So is it all right if I just move your legs apart? Okay, so that's how we're going to do it. We have a catheter set here that we're going to show you how you would do catheter care. When you're doing the perineal area, especially on a woman, you're going to start at the front and go to the back. We might have to turn her over to continue with the washcloth. We already did the crack of her buttocks when she was on her side, but it's okay to go back that way again. So it's down, back, front to back, down the crack, up the crack. So this is the catheter, and Jen is going to show us. So this is how it would be in a whether it's a suprapubic, or it would be up here, or if it's actually in the urethra. So what we want to do when we're cleaning, let me grab a washcloth, is you want to start at the site. This is a nice soapy washcloth. You're going to start at the site and go around and clean it really well. And then you're going to take the washcloth and you're going to hold with your other hand and you're going to wipe down the catheter all the way down, because that's another way to keep all the germs off. And then we're going to do the same thing with a rinsing washcloth. And we're going to dry rinse it all the way around here. We're going to hold the catheter and then follow it down with a washcloth. Keep it all rinsed. And then we do the same thing with a towel to dry. And again, when you're cleaning around a catheter, you want to start at the insertion site and make circles around it until you get all the way around, and then follow the catheter all the way down. All right. Anything else to add, ladies?
I think the only thing I would add is, depending on your client's abilities or disabilities, you'll have to communicate with them well about what they can do and what they can't do to participate. So Sherry showed one technique for moving out one leg. You can also frog leg a little bit for someone, something like this. But again, that's good communication with your client and ensuring their comfort level, their privacy, and if they've been getting cath care or cath changes, then finding out what's worked for them in the past.
Good. And then the last step we're going to do is, we've done all the bathing, so the client, all their skin is clean, we've checked her, done a skin assessment, and because of the dry climate we live in, most of our clients need lotion applied, and when skin is moist, it's less likely to break down. Now, we don't want excessive moisture, like we talked about the skin folds, so we actually have some powder to put like under the breasts, under the arms, or if they wear deodorant. It just depends on the client. Again, that's that communication piece. And then the lotion would go all over the body unless they have prescription creams, and again, it'll be a client by client basis, but that keeping that skin moist does prevent skin breakdown.
Very good.
Good. The other thing I'd like to add is note that both Jen and Sherry were using very good body mechanics, and sometimes it's difficult when you're with a client's bed and you don't have a hospital bed that raises or lowers and makes it easier for their ergonomics. So think about how you can best take care of yourself as well, using slightly bent knees, kind of a flat back, getting the client as far over onto the side of the bed as possible, to make sure that they're safe, but that also it's easier for you as a caregiver and you're not straining yourself trying to accomplish the task.
Very good.
Yeah.
Good. So we have a list of some of the steps just to kind of show you, if you wanted to write these down, about bedbound care: gathering supplies, ensuring privacy, positioning for comfort and access, temperature of the room, the blanket and towel to keep the client warm, encourage the client to participate, bathing in a head-to-toe fashion, focus on one body section. And with that, now we didn't wash Christy's hair, but if we did, we could actually talk you through how you could shampoo somebody's hair in bed, which we'll do after we finish going through this. Some of the techniques of folding the washcloth, having the 3 sides that Jen showed, clean to dirty, rinse and dry well, communicate with your client, Skin assessment, as you're doing each part, make sure you make note of that, and peri-cath care and lotioning and powders. So let's talk through a little bit how we would do this with a client who is, if we're trying to wash their hair and they can't get out of bed, they're bed bound. So if you have a client and you need to wash the hair and they can't get out of bed, if you can reposition them a little bit, even this is what we would do in the hospital, but even at home, so that their head is kind of hanging off a little bit, you just basically place a chucks underneath them. You can place a towel. I like to use a towel roll. Christy, I'm going to put this underneath your head, underneath the neck a little bit, and that just keeps the rest of them from getting wet. And then you position the trash bag under the towel. Okay, now you lay down. And what that does is that catches the excess water so that you can actually do the shampooing. So you're going to have another clean basin of water, and sometimes it helps to have a little cup, and you would wet the hair, shampoo it really good, and then you take a cup and you would rinse the water, and again all the excess water would come under here. This towel would be absorbing water as well and would keep the rest of her dry. And then you could do the same thing. Now Christy has longer hair, so maybe she wants cream rinse, and you rinse the shampoo really well. Make sure to get underneath, just like when you're at the hairdresser. They wash underneath here, and then you would apply the cream rinse, and then you would rinse again, and then you would be able to towel her hair off. And then you would take this and be very careful because this will be full of water. Can you lift your head up just a little bit? There we go. And then you would dispose of that and take the wet towel out. Do you have anything to add to that?
The only thing I would add is, again, everything that we are teaching is dependent on the client's situation, the environment, where's the bed placed, what's worked for them in the past. And so you might want to put something on the floor in case water splatters. I have clients who have buckets on the floor in addition to the trash bag. You just need to think through like what is needed, gather your supplies, have a process in mind of how to make that work in the environment that you're in. But we can help you with that. So if you have questions or you have a particularly difficult situation or environment to try and figure out what would be the best way to do that, then call your RN. We'd be happy to work with you on that and see if we could come up with some creative ways to help you and your client.
Thank you very much.
Thank you, everyone. Hope you enjoyed it.